So, parents and clinicians will be this week legally challenging the new treatment regime for young people questioning their gender. Nurse and psychotherapist Sue Evans, who blew the whistle on practices at the discredited Tavistock clinic, will seek a judicial review of the government regulator's decision to register Gender Plus Healthcare, which can refer patients between ages of 16 to 18 for cross-sex hormone treatment. And Anna Castle, the mother of a teenager with ADHD who wanted cross-sex hormones and a mastectomy, will be at the High Court this week seeking increased safeguards for teenagers referred to adult gender services. And Sue Evans and Anna Castle join me now, along with Paul Conrath of Sinclair's Law, who is acting in both cases. Welcome to the show, everyone. Sue, I want to come to you first because you were the earliest whistleblower at the Tavistock, which I believe is about to close now, finally, this week.
Yes.
But you know, you sounded the alarm, you raised concerns, you weren't listened to, really, were you?
Well, they did do a small internal report. And in fact, Dr. David Taylor, who did the report at the time, found many of the concerns that actually, if you wound forward 15, 16 years,
yes,
then became obvious in the more recent episode of whistleblowers at the Tavistock.
Yes.
But my concerns back then was actually around a 16-year-old child that I had seen referred after 4 sessions for a hormone therapy treatment. And I was just shocked by it because my way of working and my long experience in mental health work has always been that it takes time, certainly with adolescents and younger people, that it takes time to gain trust, to develop a relationship. And so an assessment, in my view, could never be done in such a short period of time.
And we've talked a lot about on this show about how, you know, Hannah Barnes's findings about between 80 and 90% of adolescents referred to the Tavistock were same-sex attracted. There were other things going on in these people's lives. It's not necessarily about a mismatch of gender and body, is it? There's other things.
That's right. And I think the difficulty with what we're facing at the moment is, and what people are finding it so difficult to come together to think about, is that if you look holistically at most of the children, all of the children that I've met, in fact, there are complexities to their life. There may well be ADHD, they may be on the spectrum, autism spectrum, neurodiverse in other ways. They can have mental health difficulties, they could have experienced traumas. So you have to really explore all of that to understand the presentation. And in my view, and my clinical experience has been that if you help children come to terms with who they are and the sort of identity issues that they're struggling with, actually those intense feelings of hatred for themselves and their body does tend to desist or die down, so
yes,
it's bearable.
But the Labour Party's official policy now is they're saying that what you're just describing, that therapeutic approach, is trans-conversion therapy. That's what they're calling it.
Well, there is a real concern around the conversion therapy bill, and I'm glad that it's been put on hold for a bit longer. I think what people don't understand is they get confused between, quite rightly, the sort of law that was against the idea that you would try and convert homosexuals to being heterosexual. I mean, I think now we would clearly say we were all against that. But actually, I don't think I know of any single clinical event where there has been conversion therapy cited and a complaint made. But the difficulty, again, is when you try and think in this area and talk about it and explore it and try and get to what is the best treatment for these children. That's what I'm about. I want to give them the best opportunity. Is that you get shouted down or you get told that's conversion therapy. I never tell a patient what they should or shouldn't think. I just try and work with them to understand where they're coming from, yes, and then gradually unfold the difficulties that they're experiencing. So, Paul,
we've learned that that puberty blockers are dangerous, that they are connected to bone problems and brain development problems, and now the NHS has banned them, except for clinical trials.
That's good
and
news.
Except for, well, yes, certainly, but there are private clinics who will be able to exploit this loophole and use it anyway. But then where does that leave people who are over the age of 16 to 18, in other words?
So if you're over 16, you can still go to the NHS for cross-sex hormone treatment. And if you do that, at the moment, there's been a change in policy last week. So you'll be assessed by your treating clinician, but then that has to go to an independent body who will then assess whether or not that has been the correct decision to prescribe cross-sex hormones.
Yes.
So that, in fact, is a move in the right direction by the NHS. In the private sector, of course, we've only got one private clinic at the moment, recently been approved by the Care Quality Commission. There is no such independent oversight in that respect. So, and the concern is as well is that the evidence for the treatment really is very, very sparse indeed in terms of its safety and in terms of its effectiveness.
Yes. So, Anna, tell us a bit about this legal challenge, because there is that danger, there is that concern of those young people who are in that age bracket, that they can, through very few consultations, jump straight to this kind of potentially irreversible medication.
I think it's insane because there's no other area of healthcare where there's such little safeguarding preliminary investigations for such a massive decision that these children, young people, vulnerable, autistic, probably gay, probably lesbian people are making. And I don't think that it should be ignored. I really don't think it should be ignored.
And is it your hope that a legal challenge will resolve this in some way, that it needs to go to that point?
Hopefully, with all the everything that's been pointed out with the lack of evidence and the negative evidence that's showing all the risk factors of the surgical procedures, the hormonal procedures, everything. There's no beneficial, nothing beneficial for it.
Yeah, I understand. Well, I should say the government regulator is the Care Quality Commission. A spokesperson said best practice guidance for gender identity clinics was considered by internal specialist advisors during the registration assessment, and the registration was granted subject to the condition that the regulated activity must not be delivered to under 16-year-olds. CQC has not yet carried out an inspection of Gender Plus Healthcare Limited. And the Gender Plus Hormone Clinic said, at a time when the NHS pathway has collapsed, with 4 years of waiting time, it is important that young people have the option of a referral to an alternative national multidisciplinary team of experts. Our service does not practice in any way that contradicts current NHS protocols for gender services. But can I come to you on this, Sue? But isn't that the point, that if someone, once they hit 16, it's almost as though they can go straight into... So, I mean, some of the concerns about puberty blockers were that they always lead to cross-sex hormones in virtually all cases. But now people can just go straight to it in that sort of danger zone.
Yes, and what's so bemusing to me is that, you know, everyone knows that teenagers are in a period of development. We've acknowledged that throughout time, you know, that... So it is strange that such a powerful medication could be given on such a small level of assessment to children that are still developing. And these are powerful drugs. They are irreversible. You go straight onto them and they will harm your body. We know that.
Yes.
We don't yet know that there's any evidence to suggest that they'll be effective for the large majority of these children. And Anna,
obviously you've been through this in a very personal capacity. I mean, you must have spoken to other people who are in this situation. There's a lot of people out there who are seeing people that they love go through something which they know can be very, very damaging indeed. I mean, how does that feel, do you think, too?
There's hundreds, if not thousands, if not more than that, of families in identical situations to mine, my daughter.
Yeah.
And there's no research going into it. We're just left, our children are left, and indoctrination is ignored.
And it's almost as though the medical facilities are, or certainly like the Tavistock, are just on board with an ideology, and they're pushing an ideology, and it doesn't really matter about the kids so much.
It doesn't. Everywhere is against us parents and our children wanting, or our children's need to have a quality life.
Yeah, well, I should say that an NHS spokesman did say NHS England has said that a planned review of the service specification for adult gender services will take place this year, which will include an extensive process of public consultation. But, Paul, that is the problem there. Adult, the idea of competency. And once you get to 16, you are competent. You can pursue your own treatment. But if you're only having a couple of consultations, the danger should be obvious.
Yeah, I mean, there's two issues here. There's capacity to consent. So do you understand what's going on?
Yeah.
And then there is the treatment safe and effective? Now, the NHS have done, through commissioning the Cass review, Dr. Hilary Cass, an independent review, looked into this and said for under 18s, the evidence simply isn't there credibly to say that in the long term, this is safe and effective treatment. Remembering this is a treatment that affects the rest of your life.
Yes.
And so if you're 16 or 17 and you go to the doctor, you want to be assured, in fact, that this is going to work.
Yes.
But in fact, we don't have the evidence. So this is the problem. And the extraordinary thing is the NHS have changed the children and adolescent approach, which is up to 18. And you can only get hormonal treatment if you've gone through an in-depth assessment, psychological assessment. But the adult specification takes young people from 17. And if you're 17, all you need is 2 appointments, no need for a psychological assessment, and you can move straight onto the drugs. Drugs, medication that will affect you for the rest of your life. And it simply doesn't make sense.
This is incredible, isn't it? Because we've been so focused on what to do with minors, and we forget that as soon as they hit that age, they can just bypass all of that. So what do we do here, Sue?
It's a hot potato to discuss. I mean, I think really, I don't know if you're aware, but yesterday there were a large group of professionals came together to discuss the evidence base for the treatment of people with gender dysphoria or gender incongruence.
Yes.
And they got shouted down, they got protested against and threatened with violence. And so it's a real problem. I certainly in my clinical experience, would like to see some special consideration given up to the age maybe of about 24, 25, because there is also a recognition that the brain is still developing and that maturity is sort of perhaps not finished maybe until we're in our mid-20s. So, and of course you get shouted down.
But why is that? Why are people ignoring the CAS review? Why are people ignoring what medical experts are saying?
Yes, again, I think there's a clash of the ideological with the clinical.
Right.
And I think if we could get back to medicine and clinical science and evidence base, I think we would be in a much better place to establish actually what is the best care for the patients that we see, because ultimately doesn't everyone who is experiencing this want to know that the medication they're about to be prescribed by their doctor is evidence-based. In any other area, you wouldn't want to just get something from your GP that was risky or hadn't been proved to work.
Yes.
And so why are we playing so carelessly, really, with young people's lives?
OK, well, fascinating stuff. I'm sure we'll come back to this story. Thanks very much for joining me, Sue, Anna and Paul. Thank you very much.